buddies, this is Dr. Nitin Bhagat. Now, I keep on getting some queries. Now, one of the queries which I got was that, sir, we are not able to understand the peri-osteal reaction. Again, this will be a very short, quick video, right? Now, first of all, let's see what is a sunburst reaction. Sunburst reaction characteristically is seen in osteosarcoma. Now, look at the central image. What happens is that bone all around is covered by peri-osteum. Intra-articular part does not have cellular peri-osteum. Now, what happens is whenever there is a tumor, for example, you see here, you can see a tumor. Now, suppose there is a tumor. Fine. Now, when this tumor is growing, what this tumor will do? This tumor will lift up the peri-osteum. This tumor will lift up the peri-osteum. You remember the peri-osteum is connected to the bone with the help of Sharpie fibers. Now these red lines, they are Sharpie fibers. Peri-osteum is being lifted up by the tumor. So peri-osteum will also do something. What will the peri-osteum do? Peri-osteum will try to form new bone. So you see the peri-osteum will form new bone like this. This black color line is the new bone which is being formed by peri-osteum. Now this new bone is deposited over the Sharpie fiber, right? And that is why you see characteristic sunburst appearance. For example, in this image, you see buddies, this is the peri-osteum which is lifted up. And these thin lines you can see, these are the Sharpie fibers over which the new bone is deposited, right? Let us move further. See, once again. Now, what you see over here, this is the peri-osteum which is lifted up. Somewhere here, there is the tumor. This is the tumor. Peri-osteum is connected to the bone with the help of Sharpie fibers. Again, you can see these small fibers. Over these fibers, new bone will be deposited. That will give rise to characteristic sunburst appearance. Now, sometimes this is also called as hair on end. You see, it looks like hair only, right? Okay, look at the third image, right? So here also what you can see, let's say this is the lifted up peri-osteum on both sides, right? And these small fibers you see, they are Sharpie fibers over which the new bone is deposited, right? I know your time is super precious, so I'll just keep this video very short. Now, sometimes buddies, what happens is that the tumor is extremely aggressive. For example, you see in this image number 1, image number 2. Now, I'll draw the tumor first. So, see buddies, here the tumor is there. This is the tumor. Now, this tumor is so damn aggressive that it will burst through the peri-osteum. Let me draw this up again for you. What has happened here? Let's say this is the peri-osteum. We'll choose a different color for the peri-osteum. See buddies. Let's say this is the peri-osteum. Now peri-osteum has been lifted up and it has been broken by the tumor which is growing very rapidly. So this tumor has ruptured the peri-osteum. And has gone out. Fine. Now what do you see typically over here in this area is a triangle. This triangle is called Codman triangle. Let's watch it in the other image. You see here the peri-osteum is just lifted up. And here you see the peri-osteum. In this area, the peri-osteum is broken. Who broke the peri-osteum? The tumor which is growing so rapidly that it broke the peri-osteum. I'll show you another image. See here. Now, watch this image and I believe you will be able to understand what am I trying to say. See here, this is the periosteum. This is the periosteum. The tumor is growing so rapidly that it broke through the periosteum. Now, this particular area will be visible as Codman triangle. Codman triangle. This particular area is visible on the X-ray as Codman triangle. See here. Now, watch these images together. I'll draw the tumor which is rapidly growing. See, this is the tumor which is rapidly growing. And this tumor broke through the periosteum. And what you can see here, that the periosteum here is lifted up. Periosteum here, like this. Now, you can see a small triangular space forming. This small triangular space is called Codman triangle. I'll erase it so that you can see this again. See here. So, the tumor is growing rapidly. This is the lifted up periosteum, and here this area is called Codman triangle. Right? Now, this is seen in rapidly growing tumors. Now, so you can see onion peel reaction. If you start peeling an onion, you will see that onion has got several layers. Now, what happens is, let's say, buddies, there is a tumor. This tumor is suppose not growing rapidly. Now, what will happen? Bone will form a layer of calcium around this tumor, so that this tumor cannot grow further. Then this tumor stops growing. Again, after a few weeks, the tumor will start growing. After a few weeks, the tumor will start growing. Bone will form another layer of calcium. Tumor will stop growing. After a few weeks, it starts growing. Bone will form another layer. Tumor stops growing. Bone forms another layer when the tumor starts growing again. So this is what you get to see. You see multiple layers. Here you can see, watch closely. There are multiple layers. So this is called as onion peel periosteal reaction, characteristically seen in Ewing sarcoma. Now, you see, this question has come to me more often than not. Every batch, 2 or 3 guys, they ask me this question. Sir, what is the difference between raindrop skull and salt and pepper skull? See, buddies, can you please tell me which is raindrop and which is salt and pepper skull? The first image is showing you salt and pepper skull, which is seen in hyperparathyroidism. Salt, as you can see, salt is white in color and pepper is black in color. Right, buddies? So here in salt and pepper skull, you will see some areas which are brightly white and some areas which are deeply black. So what happens in hyperparathyroidism? Bone is destroyed and extra calcium is deposited somewhere else. So where the extra calcium is deposited, that area becomes sclerotic, that area becomes white. Fine. And from where the bone is resorbed, that area will become black. On the right side, in the second image, what you see is typically called as raindrop skull. So in raindrop skull, you will see many black areas, but no area will be bright white, as you can see in the salt and pepper skull. There will be no area which is brightly lit, which is brightly white, because in raindrop skull, which typically occurs in multiple myeloma, in that case, you will only see lytic lesion, bone being destroyed. You will not see bone being formed anywhere, right? You see, raindrop skull like this. So you will see many small areas which are black in color, but you will not see any area which is bright white in color. So that is the difference between raindrop skull seen in multiple myeloma and salt and pepper skull seen in hyperparathyroidism. Right, buddies? Okay, again another query very often comes to me, sir, we are not able to understand in which cases to do surgery. That is, in which cases you need to do open reduction and internal fixation. Yes, that is a very, very valid query. Fine. So you will do surgery in those cases, in those fractures where there is very high chance, to undergo non-union. Very high chance to undergo non-union. For example, buddies, if there is neck of femur fracture, especially if it is intracapsular, right? You will do surgery. What surgery will you do? Hemi-arthroplasty. For example, lateral condyle of humerus fracture. Lateral condyle of humerus fracture. Fine. Now, here you see there are very high chances of non-union because the extensor muscles, they pull the lateral condyle away, right? You will do surgery if the fractures are around the wrist and the fractures are intra-articular. For example, you will prefer the surgery in case of button fracture. Now, around the wrist, even if the fracture is extra-articular, and the fracture is displaced. For example, if there is Gallese fracture, you will prefer to do surgery. Fine. Again, speaking of the fractures which are displaced, again, in the displaced fractures, you will do surgery. For example, Monteggia fracture, there is displaced fracture, so you will do surgery. Again, the fracture which have got high chances to undergo malunion, for example, extracapsular fracture of the femur, you will do surgery. Fine. So if you know that this fracture is not going to unite because the muscles are pulling them in opposite direction, you will do surgery. Fine. If you know that the vascularity is very, very poor, for example, in neck of femur fracture, you will do surgery. Now see, let's say your patient has got supracondylar fracture of humerus and that fracture is displaced. You will do surgery. So speaking of that, there are some fractures. For example, Gallese fracture, supracondylar fracture of humerus, and lateral condyle of humerus fracture. So these are called the fracture of necessity. If you don't want to remember anything, just remember these things, that these are called fracture of necessity where surgical treatment is necessary, right? So if my kind and humble request, if you have got any queries, you all have my number with you, right? So if you have any queries, please do send me your queries and I will make these kind of small videos. Many thanks for being here with me. Thank you so much, buddies. All the best.